You're listening to the OCD Stories podcast, hosted by me, Stuart Ralph. The OCD Stories is a podcast dedicated to raising awareness and understanding around obsessive-compulsive symptoms. I do this through interviewing inspired therapists, psychologists, and people who have experienced OCD. Welcome to the OCD Stories. And welcome to episode 429 of the podcast. And in this one, I got back on Dr. Michael Greenberg. Michael is a clinical psychologist who specialises in rumination-focused ERP. And in this episode, we discuss what's new with him. He then answers listener questions. He explores how RF-ERP has helped people, learning to let go of the questions, some justifications of rumination that people use sometimes to justify it, persistent obsessions and urges, and much, much more. And thank you to NoCD for supporting the podcast. NoCD offers effective and convenient therapy available in the US and outside the US. To find out more about NoCD, their therapy plans, if they currently take your insurance, or to download their free app, head to go.treatmyocd.com/the OCD stories, or the link will be in the episode description. Thank you to all of our patrons for supporting our work. To sign up to our Patreon and to check out the other benefits you'll receive as a patron, please see the link in the show notes. So thank you to Michael for his time. I deeply appreciate it. It's always a pleasure to chat with him. And of course, thank you to you guys for listening. It means a lot. And thank you to those of you that emailed me questions since I last had him on. Without further ado, here is Michael. Welcome back to the show, Michael.
Thanks for having me.
Okay, take two. I've hit record now. So, as I've already said, but no one got to hear, I got to meet you recently in person in London, so that was cool to hang out with you. And yeah, but you know, for everyone else, what you've been up to since we last spoke, and anything new you want to share?
Yeah, I mean, I guess largely I've been focused on continuing my deep dive into the psychoanalytic side of things. So I've been in analysis and consulting with a psychoanalyst about cases and taking courses at the Psychoanalytic Institute here. So I'm learning a lot. It hasn't left me a lot of time for writing, but I'm hoping that I've decided that after this year of coursework wraps up, I'm going to skip a year so I can actually finish some projects. Yeah. So that's where I've been.
Okay, awesome. And I'm sure you're learning a lot as a result. Would you ever want to become a fully fledged psychoanalyst?
Mm-hmm. In my mind, being an analyst isn't about the title. It's about having this really intensive training, everything from infant observation to learning all of the primary sources about psychoanalysis and the whole development of the field. So I would definitely like to do that. So yeah, I guess I would like to be an analyst one day. I don't know if I'll practice as an analyst. I don't know if I would ever practice fully that way, but I definitely want the training.
Yeah, amazing. Yeah, I've done infant observations as part of my training.
Was it really cool?
It was awesome. Yeah, at first you're like, "What the hell am I looking at?" But then it starts to become quite vivid.
Yeah.
Yeah, and you learn so much about those early days and how crucial they are for us. Yeah, you mentioned about writing more articles. So my question was going to be, have you, since we spoke, have you written any more and put them on the website?
No, I have a lot of drafts of articles that are 80% ready to go, but need editing, and editing is the months long process. So I have a lot of things in the pipeline, but I haven't given them the time that they need to see the light of day. Yeah.
All right, cool.
Hopefully soon. We'll see.
Yeah. All right. Well, exciting for the future. And I heard ages ago, a long time ago, I'm not sure how long that is, but then someone reminded me recently, and I'll ask you now. They said you're getting RF-ERP researched by a university.
That was true, and is no longer happening. Yeah,
okay.
We started a partnership with Dean McKay very generously offered to sort of guide us in this empirical research process. And then all parties involved were basically too busy.
Okay. Yeah.
I mean, that is an excuse. I mean, yeah, we'll see. Maybe one day. But also, I think my attention has been more on the analytic side of things.
Yeah.
For better or for worse. It's just where my passion is.
Yeah. It takes a lot of time and brain power, right, to do research. Maybe you need someone who's going to dedicate their PhD to it, and like they can focus on it. And if it's funded by a university, then all the better.
What we learned from Dean McKay is that there are also all these like preliminary things you would have to do, like first concept paper and some case write-ups, and then like slowly you would get towards an actual randomized clinical trial.
Yeah.
And that would be in a world where I had infinite time and energy, that would be what I should do. But I see a full caseload of patients and do a lot of other stuff. So it's on the back burner.
Okay.
It's awesome. So yeah.
Yeah, well, that clarifies it for me and anyone else that heard that. So one day, let's watch this space.
Hopefully.
Yeah, cool. So today we're going to talk about listener questions. So as I said to you when I met you in London, I know you hadn't done the articles or wanted to cover anything new at this point, but it'd be good to get you back on just to clarify some things, because I get lots of emails about you. Which says something about the episodes. So the first question was, I thought this was quite an interesting one, is can Michael describe a specific example where this treatment approach has helped someone? I'm sure you can describe many, but any examples come to mind of cases that were really helped by RF-ERP?
Sure. I'll give a couple of examples of I think when people think of RF-ERP, often we're dealing with ruminators, but RF-ERP is not just a treatment for pure O, it's for other OCD cases as well. I'll give you two examples of non-pure O cases that I think were really helped by this approach specifically. Just a couple that come to mind. So one is, there are a couple of articles on the website that talk about people who have like compulsive urges. I guess you could call any compulsion an urge, but like to move their hand a certain way or to engage in a certain ritualized behavior. So for some people like that, there might be a feared consequence of not doing it. Those are more typical cases, and regular exposure is more helpful to those people. But then there's a subcategory of those cases where the person is not afraid of any external consequence. They're afraid that the feeling of that urge, which is itself distressing, won't go away until they engage in the behavior. And what happens is for people who don't know how to stop ruminating, they have the urge and then they sit there ruminating about whether or not to gratify the urge. And so that means that functionally there's no way out, because what I should add is that ruminating about whether or not to gratify the urge perpetuates the urge. And so if you don't know how to stop ruminating, as soon as you have the urge, you're sitting there ruminating about it. That means that the urge keeps on going until you do the behavior or whatever it is. And there's really no other way out for those people. And in those cases, teaching a person how to stop ruminating and showing them that they can use that to turn off that urge is like life-changing. Like that's before there was no other way out, and now there is another way out of that feeling. And so that person can now have the urge disengaged from the debate about whether or not to gratify it and make the urge go away. And so there's like another way out of that situation. So I'm thinking of multiple cases, but one in particular where somebody's life was really dominated. I guess this is true for a lot of people with this presentation, by like this urge could come on at any moment. And then they would have to do this behavior, which I won't go into detail, but was something they found very shameful and very distressing. And in that case, just showing them not only how to stop ruminating, but also showing them that by not ruminating, they could step out of this feeling that was a really helpful intervention for them. And this goes also for contamination cases. There's a parallel type of contamination case. So like we said, sometimes with the urges, there's a feared consequence of something bad that might happen. And sometimes it's just that feeling will keep going. So in contamination cases, the same thing. Sometimes there's a fear of something bad happening. I'll poison someone, they'll die, etc. But other times it's just that the feeling of contamination itself will become inescapable. And so there, it's the same concept in that case. By ruminating about what is contaminated and what isn't contaminated, by keeping track of the contamination, the person perpetuates the subjective feeling that things are contaminated. And the reason that RF-ERP is so important in these cases is not just because it's helpful, but because traditional ERP won't work. So if you have somebody who's keeping track of what's contaminated, and therefore things continue to feel contaminated, if you just do regular exposures where they contaminate things, it won't help them as long as they're still keeping track of what is contaminated, because they'll continue to have that feeling subjectively of contamination. This was a long-winded answer. Do you think it is clear enough?
Yeah, I think it is. I'm really interested in the contamination example, because I think I have a few cases very much like this at the minute, where, I don't do traditional ERP, I do a slightly adapted model, but it is tough. So when you do the RF-ERP adapted exposure, how are you doing it with this client who is monitoring what is contaminated and what isn't?
So number one is they have to know, we're showing them that the feeling of things being contaminated is generated by the fact that they're keeping track of what is and what is not contaminated. Okay. That's what makes things feel like they're contaminated or not for those people. That feeling will continue until they disengage from keeping track, and that they can turn off that feeling by refraining from keeping track. And so we're doing exposures with a focus on not keeping track. What that might look like. So for example, if somebody like that, if you touch whatever the contaminant is to something else, it wouldn't do anything for them, because they're still as long as they're keeping track, nothing changes. Does that make sense?
Yeah.
And so I've seen cases like this, multiple cases like this, where people have gone through really intense exposure and it hasn't done anything because they haven't changed the rumination piece. And what exposure might look like if I were doing it, we're not just teaching somebody how to stop ruminating and then getting them to stop ruminating, but also contaminating everything so that there's no such thing as trying to contain the contamination, so that there's no keeping track. It's just everywhere. And so the exposure wouldn't be touch this to that. The exposure would be spread this everywhere. So, and then that allows a person to fully let go of having any sense of keeping track. And then potentially the feeling goes away. Now, of course, I'm saying this all on a CBT level. Clearly, I also believe there's a deeper emotional level that's also part of the picture. But just on a CBT ERP level, it would be a very different intervention, where I think that traditional ERP wouldn't really get the job done. Or I've seen cases where it really hasn't.
Okay, fair enough.
Yeah. Those are two examples. Do you want other examples?
If you've got them, yeah.
Another example would be, I'm thinking of somebody from a few years back who had emetophobia, which is a fear of vomiting. And they had done a traditional ERP program that had made them it made things worse. I'm not saying that would be true for everyone. Okay, I'm not saying ERP makes things worse. For many people, make things better. For this particular person, maybe it was how it was delivered, but they would have this person eat the thing they were afraid to eat. They were afraid that if they ate certain things or did certain things, it would make them vomit. And then they would do things that would make the person very afraid of vomiting. It was eat the thing and then take a ride on a bus and then make yourself as nauseous as possible, and et cetera, because the idea is habituating to whatever, make things as habituating to anxiety, make things as anxiety provoking as possible. So in this particular case, I don't know the mechanics of why, but this definitely made the person worse. I think they became more scared. Again, I want to reiterate, I'm not saying that overall, okay. What this looked like from an RF-ERP perspective is we want to keep anxiety as low as possible. We want to turn it off if possible. So we're going to not ruminate about what we're about to do. We're going to pop in the food that's not allowed. It was sushi. So we're going to bring sushi to session. We're not going to ruminate about what we're going to do and whether we're going to vomit. Anxiety is brought down. Pop in the sushi, don't think about it. Continue to sit there without engaging with it. And then you find out that you can eat the sushi. Not only do you not vomit, but you also find out that you don't get significantly anxious. Makes sense. Also, while refraining from directing attention towards your stomach to figure out if you're feeling nauseous, planning for what you would do if you became nauseous, things like that.
Yeah.
So it's keeping anxiety down, not doing any of these mental compulsions, and that was very helpful to this person. And that also, I think, made him feel more comfortable doing exposures on his own.
Yeah, yeah, and look, as you talk like that. Well, one, it's obviously more in line with inhibitory learning, which is your brain's learning something new as opposed to habituation. But, the way you're describing RF-ERP, doing ERP, is very much how I see an ACT-enhanced view of ERP. And I don't want to get into the ACT debate because,
Don't worry, I've grown enough to not want to get into it either.
Yeah, no, we talked about that when we met. But it's more, I just wanted to highlight because my goal in ERP is like we do the exposure and then maybe we drop anchor, like notice what's around us, and then we refocus on something that matters to us. And the goal there is not distraction, it's focusing on valued living. But in the same way, it's somewhat achieving what you're saying in letting your mind wander. You're not, I know, there's going to be distinctions, but it feels like they're much closer than you think. I think you're much closer aligned to ACT than you are pure ERP.
Well, the records show I have objections to many components of what you just said. Fine. But yes, in terms of we're trying to raise anxiety during exposure, we're trying to lower it. It sounds like that is a common denominator.
There is a very good overlap between the two.
I can agree on overlap.
Yeah, fair enough. It's progress.
Yeah. The way I think that the simplest way to think about it is in terms of restoring agency, showing a person that they can do the thing they're afraid of, showing a person that they can actually disengage from this rumination, etc.
Yeah, I completely agree with what you just said, their agency and showing that they can disengage from the rumination. 100%. Yeah.
And should I do one more example?
Yeah, go for it. Yeah.
Just like the typical example would be, and this is, I think, what people think about, or more people who are looking for RF-ERP, I think, are pure O cases. So in pure O cases, it would be about, first of all, recognizing that when you're anxious, what's happening is you're trying to figure something out. So for example, a person with HOCD or SOOCD, they're not having the thought, you're gay, you're gay, you're gay all day. They are sitting there trying to figure out if they're gay. And not recognizing that somebody sent in a question a few months ago that I really loved because I thought it really explained it really showed how people are thinking about this incorrectly. It said something, this is not an exact quote, but it was, if you stop engaging enough, the mental loops will eventually stop. So what I thought was notable about this question was that it showed that this person thinks that the engagement and the mental loops are two separate things, and that you can somehow hold on to one while getting rid of the other, or something. Basically, that they're separable in her mind. And I think this is how a lot of people with pure O originally are thinking about things. And what we want to show them is that no, the mental loops are themselves you trying to figure this out. These are not separable things. And so you can't try to figure it out and also get rid of the rumination. You have to get rid of the whole thing because they're the same thing. And so showing people that their entire thought process after the initial anxiety, that their entire thought process is them engaging, and that's what's perpetuating their anxiety, and is often the context for further triggers and further anxiety. That's an important starting point. And so teaching them how to stop ruminating, because we don't know intuitively, people with OCD at least, And then helping them to do that consistently can be very helpful to people.
Yeah, good point. I like that example. So this was a very broad question, but I guess I'm sure there's lots of people wondering this. But they just said, are there any other exercises for learning how to do nothing? So obviously some people get this concept and have read your article, and some people maybe find it harder to understand how to do nothing. Just anything you want to say on that?
Yeah, I wouldn't think of it as doing nothing, because that sounds like we're actively trying to do nothing. The way I would think about it is more that we want people to recognize that ruminating is doing something actively. It is actively trying to figure something out. And we're not trying to get them to do nothing. We're trying to help them recognize all of these things that they're doing. And once they can recognize that they're doing them, to let go of doing them, and then be able to disengage from the question or the thing that they're working on. So you don't have to be doing nothing. You could be doing literally anything. A couple of metaphors. I don't know if I've shared these in the podcast in the past, but one that's come to mind recently is it's sort of like if you were sitting at your computer at work and you had like some work in front of you, some assignment that you were working on. Working on that isn't something that just happens to you. You would have to actively decide to start paying attention to that assignment and start engaging with it analytically, like to start working on it. And so we're not asking people to do nothing. We're showing them that when they're engaged with this problem, it's because they're directing attention towards it and working on it. And so we're teaching them to recognize that they're doing that and to let go of doing that. All of the little stuck points in the article were like, you might be doing this, you might be doing this, you might be doing this. Those are just things that people sometimes don't realize they're doing when they're trying to stop engaging with something. Those are the things that people might do that keep them engaged with something while they're trying to disengage. So for example, somebody's trying to disengage, but now they are just keeping an eye on the problem. They might not recognize that they're doing that. So we want to show them, that's what you're doing. If you want to fully disengage, we have to stop doing that too. Or maybe a person is trying to disengage, but they're coaching themselves through it, which is also keeping them engaged with this issue. And so we want to show them that they're doing that and have them stop doing that too. So it's sort of like all the different ways that they might accidentally be holding on. We're helping a person to let go and helping them to recognize the things they might be doing without realizing it that are still ways they're holding on. Does that clarify?
It does. It does. So, the next question was, please ask Michael about the justifications of rumination, which you've got an article on, and how to break its spell. So just anything you want to say on the justifications of rumination and breaking its spell.
That is my top priority. That is my top priority article to rewrite. So the old one, I think, is very limited in terms of, how much time do we have? Do you want me to go through an algorithm for justifications?
You can dedicate a bit of time to this. Yeah.
Okay. Let's do it. So I've developed this. So basically, when it comes to justifications, a couple of preliminary things. Number one is a person needs to recognize that they can't have it both ways. In other words, you can't ruminate and not ruminate at the same time. When it comes to physical compulsions, this is obvious. You can't wash your hands and not wash your hands at the same time, but things are a little less clear when it comes to thoughts and thinking. So we want a person to recognize that they are trying to figure something out. They think that's very important. And that if they want to stop, they're going to actually have to stop. They can't both stop and also have a part of them that's still trying to figure it out. Because a lot of people with OCD won't recognize that they're trying to have it both ways because it feels so important to figure it out that they aren't really willing to let that go. Okay, so we need a person to recognize that they can't have it both ways, okay? That's number one. Number two is, unless a person knows how to stop ruminating, like their technique is good, they understand how to do that and they can get down to a 0, it's not relevant yet to talk about justifications. Because if you don't know how to do something, it's not relevant to talk about how motivated you are to do it, for example. Okay, so number one, person needs to know how to do it. They need to work on how to stop ruminating, how to stop paying attention, be able to get it down to 0. And number two is they need to recognize that they can't have it both ways. It's in or out. Okay. That's an Elna Yadin quote, in or out. Okay. So once we've established both of those things, what we need is for a person to identify the justification. In other words, they need to be able to name why they feel it's really important to do this thing. In other words, why is it really important to figure this out? Okay. Once they identify what the justification is, or another way of putting it is what the value is that they see in ruminating, then we can run that through this algorithm I'm going to share with you, which I think a good way to assess if this really makes sense. Okay, so here's the algorithm. Number one is, does the question even make sense? In other words, is this a question that has a built-in problem that makes it unanswerable? So for example, two examples of this would be, am I in the right relationship? Is this the right job for me? Which school is the right school for me to go to? Those would all be good examples of questions that are unanswerable because they assume that there is a right answer, and in reality, that doesn't exist. And so you're never going to find an answer to that because the question doesn't even make sense. Or similarly, you could have any other version of a split. Like a split would mean seeing things in black and white terms. Is it this or that in a way that's not nuanced enough to make sense? Like, am I a genius or am I an idiot? Right? And in OCD, we do have a lot of splitting, and it is sort of baked into a lot of obsessions. And so off the bat, if a person can recognize that there's a split, they could potentially recognize that this is an unanswerable question because there's a built-in thing that doesn't make sense. That is not realistic. Okay, so that's number one. Does the question make sense? If the question doesn't make sense, then you will definitely not find a satisfactory answer to it, and you're making yourself miserable for no reason. So stop. If your question does make sense, then we move on to the next question in the algorithm. And that is, does it make sense that you would be able to figure this out just by thinking? So there's this concept in psychoanalysis called omniscience, defensive omniscience, which means believing that we know more than we know. And so a lot of times this is also baked into an OCD process. Like, a person is trying to figure out what will happen if they do this, as if there's a way for them to know, or trying to figure out what would have happened if they did that, as if there's a way for them to know. I've had people who are trying to figure out things. I won't give the examples because maybe they're identifying the one that comes to mind, but just trying to figure out something that there's literally just totally no way they could possibly know from within themselves. It would require like consulting and doing research. But there's this feeling when you have OCD, like somehow without acknowledging it, you have this feeling like if you just dig deep enough, you can find the answer within yourself. Another example of this would be somebody who reads the Malin article and then says, I need to dig deep and figure out what my unconscious feeling is. You know, that would be like, there's no way that you're going to figure this out just by thinking. Okay. So next, going back to the algorithm. So if it's not realistic that you could figure it out, then you want to use that to say there's going to be no end to this ruminating. There's no way I'm going to find an answer to this. If the question does make sense and it does feel realistic that you could figure it out, then we move on to the next question. Okay, the next question is, has it worked in the past? Okay, so this is someone who says, this question does make sense, and it does make sense that I would be able to figure this out. At least in their mind, it feels like it makes sense. So then my question would be, well, okay, how many times have you done this in the past? How many times have you felt like this is the time I'm going to figure it out? If I just push hard enough, or I'm on the verge of figuring it out, and if I just try hard enough or think about it a different way, et cetera, how many times have you done this in the past, and has it worked? Okay, so if it hasn't, then that could also be a way of recognizing that this rumination is not valuable, that it's not going to get you anywhere. Next, just to give two examples here, this might be somebody who feels like I'm on the verge of figuring this out. If I just push myself hard enough, I'll finally be able to figure it out once and for all and stop struggling. Something that many people with OCD have felt. And again, you want to remind yourself, I have felt this way many times in the past, and it's never yielded anything. So maybe I can just skip the part where I make myself miserable and just turn it off. Or another example of this would be someone who says, this isn't OCD, I'm just in denial, and I just have to finally accept the truth and I'll finally be free. Kind of another version of the same thing, which is something a lot of people with OCD, especially pure O, have thought. So again, how many times have you thought that in the past and has it gotten you anywhere? So maybe don't bother. Okay. Okay, next. So if we're at this point, a person would have to say, this does make sense and I can figure it out and it has worked in the past. It has been constructive. So then my question would be, is there a different way to accomplish whatever it is that rumination has accomplished in the past? So a person says it has worked, I have figured it out. So then my question would be, is there a way to separate out the functional part of the rumination from the compulsive part? Okay, so let's say a person says, in the past, I did ruminate about whether I had a certain medical problem, let's say, and that did yield. So let's say we could have, going through the algorithm, let's say a person is sitting there ruminating about whether they have cancer. Okay, I would say we would get off the algorithm at the omniscience part. Like, does it make sense to you that, so, okay, the question makes sense. Do I have cancer? The next question would be, does it make sense that you are able to figure this out? Right? Does it make sense that you're able to detect, like based on just thinking or paying attention to your body, that you're going to figure out the answer to this question, or you're going to figure out what diagnosis you have, etc. Okay. Let's say the person says, not cancer, but this is a person who's paid a lot of attention to their body. And in the past, that's allowed them to detect, I don't know, some version of something that happened in the past. So then the question might be, okay, so now you have this feeling like I need to pay attention to my body to make sure that I don't miss whatever it is. So then my question would be, does that really necessitate you paying attention like this all the time in the way that you are? Or is there a way to separate that out? Is there a way to accomplish the same goal without the compulsive part? Mm-hmm. Okay, in the interest of time, I'll skip examples, but that's the next question. Mm-hmm. And then let's say the person says, no, there's not. Okay. Then my final question would be, and I think this is also a broader topic, at what cost? In other words, okay, you are completely convinced of the value of what you're doing and that this is actually a question that needs to be answered and can be answered and you can figure it out. You can't do it another way. Then my question would be, at what cost? In other words, in the obsessive compulsive mind, if you're doing something good, then it must be good in all ways and it doesn't have a downside, right? If you're doing the right thing, then it doesn't come at any cost. And in reality, just because something is good doesn't mean it doesn't have a downside. So for example, if a person said, so a person could say, it's true that if your kids don't go in a car, they'll never get into a car accident, but that comes at the cost of something else. For example, that comes at the cost of your kids' social, emotional development and their autonomy and their having experiences in the world. Fine. So the final question I would ask somebody who's ruminating and said there's a value in this, and there is a question that makes sense that I can answer and I can figure out, and I've done it in the past, and I need to do it this way. So I can't get them to give up on the value of what they're doing. They say there is a value. Then my question would be, what's the downside? Mm-hmm. Okay. This comes up, for example, in moral justifications, where somebody might say, well, this is good in some way. Then my question would be okay, let's acknowledge that it's good in some way, fine, according to you. And then is it also bad in some way? Does it also have a downside? And sort of broadening the perspective that maybe, whatever. Without giving examples, does that make sense?
That does, yeah. Well, in ACT, we'd call that creative hopelessness, trying to get them to see that what they're doing is hopeless. To drive that motivation to quit and try something new. Quit the rumination, for example.
Mm-hmm. Yeah. Makes sense. Yeah. Okay. So that's, I mean, this doesn't, I think there are as many justifications as there are people. So this addresses some of the common ones. It doesn't address all of them. For example, it didn't even address the common one of, I think if I do this, it'll make me feel better. I think by ruminating, I'll feel better. Sort of that is just, that's not true. ruminating will make you feel worse. You are making yourself feel anxious.
Yeah.
Or somebody who says, like, I need to figure out if I need to plan and prepare for this trip. Well, then again, that's a good example of the last one. Let's say a person says, I need to plan and prepare for this trip and I'm going to manage my anxiety on this trip. That would be an example of someone who's doing something that they think is going to make them feel better, but is actually making themselves anxious in the process.
Yeah, but I think the flow of questions and justification is really useful to go through. Because with OCD, there's always like this there's always a but at some point maybe you'll get to them where they're like, okay, yeah, I see it's pointless, or it's not helping me. Yeah.
The main thing is recognizing that you can't have it both ways.
Okay.
That's the main thing. Also, just to clarify one thing, we're not suggesting that every time a person has the impulse to ruminate, they start going through the algorithm. Most of the time, hopefully, you just know we're not doing this. Yeah. But maybe if there's a stuck point where you really can't stop yourself, then you really want to think about what is the story I'm telling myself about why this is really important. And using an algorithm to help you deconstruct that and make a decision to go the other way. Yeah,
that's useful. That was really good. Thank you for that. I'm just looking at my questions and considering time. Okay, so this next listener asked, my question is on the obsessions/urges that continue to persist over and over again until I finally give in to them and carry out the compulsion. They're extremely persistent and don't seem to fade.
Okay, this is a person, this sounds to me like the first case we talked about today.
Mm-hmm.
Right? It continues to persist until I do it. What I hear, my guess is that this is a person who's sitting there debating, going back and forth. Am I going to do it? Am I not going to do it? That perpetuates the urge. Mm-hmm. And then there's no other way out but to finally do the thing. And so for this person, my intervention would be to cut out am I going to do it? Am I not going to do it?
Yeah.
To disengage from debating with themselves about whether or not they're going to gratify the urge.
Yeah. Okay.
I think that's why it persists until they do it.
Yeah. 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 They're ruminating, right? Keeping it going.
A specific type of, yeah.
Yeah. Okay. So this came from a therapist friend of mine. So is it, and I asked it more as a challenge, but is it truly on the person if they can't stop the compulsions or the rumination? So I think
yeah. I think this goes to sort of the broader question. I think there's, if you want to think of it as a dialectic or as like it's both are true. I believe in emphasizing how much control a person with OCD has and showing them that they can technically turn off rumination. On the other hand, there are, on the other hand, the people who heard and I think the reason the first podcast was so impactful to people was that someone told them that they could control this and they had never realized. And that's what a lot of people wrote in to say. Then the backlash came from people who were like, you're victim blaming and you're making this too simple. And of course you can't just stop your symptoms. So I think there is truth to both. And I think for me, the second part is represented by like this more psychoanalytic perspective. In other words, there are emotional, relational issues. There are traumatic experiences from the past. There are reasons that you find it so that you're triggered by certain things, and that you're predisposed to coping with that by ruminating. And just telling someone to stop does not address any of that. And so it's not a sufficient answer, right? We also need to look at the bigger picture of what are we need to try to address and attenuate the emotional factors that are making a person feel like they have to do this, that are making a person so scared. Okay. So I acknowledge that. And if I were listening to that original podcast today, I would also take issue with just the black and white, how I said things, that it's all within a person's control. I think that came from my own need to believe that at the time. Okay, but mea culpa, that was not something that I would say these days. At the same time, I don't want any of that to take away from a person knowing that truly, technically, you can always stop ruminating.
Mm.
If you are anxious, if you are having an OCD episode, you are sitting there trying to figure something out, and you have not made a decision to stop trying to figure it out. And if you can make the decision to stop trying to figure it out, you will feel much better. I have been in moments where it is extremely hard to make that decision because it feels like everything's falling apart and you just need to keep going in this destructive direction. So I understand what it feels like to not be able to make that decision because you're so distressed. And at the same time, it is still the case that I continued to feel anxious because I was not making that decision. And that I could in that moment, and at times I did in those moments, make the decision to turn it off and I would feel better. But it would be hard to make that decision. So both are really true. It is not nearly as simple as, oh, if we just teach somebody how to stop ruminating, their entire problem goes away. That's naive and also reductive and also just not true. Okay, so that's true. But on the other hand, people with OCD do not realize that they can turn off their rumination. They don't realize that they're anxious, that their anxiety is being perpetuated because they are ruminating, because they're trying to figure something out. They don't realize that they can stop, or they don't know how to stop. And I'll take a single jab at ACT today. A lot of our interventions collude with that idea. When we tell people to just accept it, when we tell people to just be mindful of it, instead of you can stop and you have to stop, then we're not sending the clear message that you can actually control this whole thing. This whole thing meaning your experience of anxiety and rumination.
Yeah.
Is that sufficient? Like, both are true.
Yeah, no, it's a really good explanation. And we discussed this off air when we met, right, about your views of the first episode. And look, to some extent, I think that episode needed to come across at that time because maybe it needed to shake things up a bit, right?
Can I jump in actually
yeah.
first? Can I interrupt?
Yeah.
I think my tendency these days is to, because I feel that there was so much lacking in my perspective back then, my tendency now, my bias now is to like understate the importance of what I said in the first episode. So I want to make sure that I don't do that. In other words, let me emphasize, I get emails all the time from people who say that they never realized they could stop ruminating. They use the articles to stop and they feel better than they've ever felt. Okay. That is real. And I've also seen patients who I just did that kind of CBT intervention with back in the day. And these are patients I continue to see for psychodynamic psychoanalytic treatment. So I know how they're doing. And there are patients who were seen with those interventions. They don't have those issues anymore. There are also patients for whom that is not true. Okay. There are patients for whom just how to stop ruminating and turning it off did not solve the problem. There are deeper roots. There are other things going on. I mean, there are always deeper roots. So I'm not saying that's all cases, but I don't want to understate how much of an impact this can have. There are people for whom learning that you can stop ruminating, learning how much of your suffering is caused by something you're unwittingly doing on purpose, meaning unwittingly you might not realize that you're actively trying to figure this out, but you are actively trying to figure this out and you can stop. I don't want to understate how important that is. That is massively important, even as it's also true that there's much more to the picture.
Yeah.
Does that make sense?
Makes perfect sense. Yeah, 100%, 100%. And just to ACT's defense for a second, the way I do ACT, I don't make people just accept, right? That's it's much more aligned with the way you're doing RF-ERP. And in fact, I use a lot of your teachings within the way I do ACT.
So is that ACT or is that Stu?
It's always Stu. I'm very much the belief of...
I mean, it's just because you have practiced when I was learning ACT back in my training, it was like leaves on a stream, for example. Leaves on a stream is mindfully ruminating. I don't mean to get into it.
Yeah.
I get it. I know that there are people who practice ACT in a way that is very consistent with how I do things.
Yeah.
But
No, I don't do leaves on a
practice,
stream.
there are also people who practice ACT in a way that's, I think, really not helpful.
No,
So,
of course. But there are many teachers in ACT that have different views and different ways. So it depends on who the teacher you're training under is how you're going to deliver ACT. But yeah, I'm a big believer in I'm a therapist first, and then I do these other therapies on top. I'm not an ACT therapist. I'm not an ERP therapist. I'm a therapist that does ACT. I bring in some RF-ERP. I want to bring more of it once I've done more training in it. The minute I don't feel skilled enough to reliably use it. Although I have had success previously when I did dabble in it. You name it. But yeah, I'm a big advocate of you're not a CBT therapist, you're not a psychodynamic therapist, you're a therapist. That's the primary skill, and then you build these theories on top. Anyway, that's my political view of it. But
so breaking down this split, what Michael needs to accept is that not all ACT is bad. But I think what Stu needs to accept is that there are people who practice ACT in a way that's in a way that is still ACT. That is still. It's not that they're doing it wrong. They're doing it right.
It's a version of ACT,
and it's not helpful.
Oh yeah, 100%. I agree with that. Yeah, but same as I agree there's people that do ERP that I wouldn't do it like that. You know, there are people that do ERP that actually I think are amazing. So it's I agree, but that's all therapies. There's the good and the bad, the light and the dark. So all right, good. So look, one last question. So this person said, after the dramatic symptoms of OCD are gone, how can we really push into the underlying avoidant tendencies we learned growing up? It seems so easy after treatment to plateau into a non-confrontational, quite isolated, mildly dysfunctional state. Do you have any long-term tips, for example, learning to proactively express disagreements and healthy anger?
I'm going to give a very short answer to this question, which is I think after a person has gotten what they can from a behavioral treatment, I would strongly recommend pursuing a psychodynamic treatment. In other words, I think my biggest critique of CBT in general and ERP is that it doesn't know its limits. In other words, ERP is tremendously helpful, but it thinks about it. People think about it as if it's the whole picture, as if it should have no limits in what it can do. That is not based on data. The data are that ERP is very helpful to some people, not fully helpful to anyone, and not helpful to everyone. So with that in mind, we don't want to keep somebody in a strictly ERP treatment forever. We want to do what we can, get what we can out of it, and then recognize that this is a limited treatment, and there are other treatments out there that can also be of additional help. So let's do our behavior. If somebody comes to me, if I need to make a referral out, like if I don't, in our practice, we integrate both. If I need to make a referral outside of our practice for whatever reason, whatever, and I don't have an integrative therapist who can do both, what I will tell someone is first go to a behaviorist, do ERP, get as much out of it as you can. But keep in mind, this is a time-limited treatment and that it's not going to give you everything and that there's more out there. So do your behaviorism, spend the months, do ERP as hard as you can, get what you can out of it. And then we want to refer to someone who can work on the deeper issues.
Yeah, good point. Yeah, I'm not in disagreement with that point. I've said that for a while. I've not always said psychodynamic, but I've said like relational. Someone you can go deep with and feel safe with and connected. And especially if there's attachment stuff, you can start to heal some of that or work on it. I think, I did 8 years of that. I recently finished, like we said, when we met. And I'm so glad I did that. Well, I'm definitely not all better, but there was so much. But I needed the time. To work through stuff that was really ingrained.
And I've been in an analysis for 4.5 years. So agreed. There's just a lot to work on.
Yeah, and sometimes non-CBT therapists are actually a lot cheaper than at least in the UK, than CBT therapists. So it's not like you have to do 8 years at the cost of CBT.
Can I revisit what you said about ACT? I don't want to have had another like episode where I like got into it about this. I understand what you're saying. I understand what you're saying, and it's a valid point that you can do ERP poorly or not or well. And I think I think this is maybe a little bit of my own splitting, saying like ACT bad because ACT is not all good. ACT is bad. And so I think maybe a more nuanced and also accurate way of saying it is that I have certain critiques and concerns of ACT. Yeah. And I think that if those concerns and critiques are taken into account, it can be helpful.
Well, I agree. And I think if someone's doing ACT in a way you're saying, I wouldn't do it that way. So
I understand.
The people I know that do ACT do it in the way I do it. Like Russ Harris is a good teacher of ACT. And his model, I think, aligns much better. But yeah, there are many tools and skills that have come out of ACT that just may not be helpful or useful for OCD. But there are many, I think, that have come out in recent years. So, yeah. But no, I think it's come across a lot more nuanced and balanced. And me challenging you is just me trying to be a bit more of a balanced interviewer and trying to. But I'm open-minded to it all, as you know. Otherwise, you wouldn't be here, right? And it's great to have you on again. And yeah, thanks for coming on.
Always a pleasure.
Thank you for listening to this week's podcast. And thank you to our Patreons who helped make this episode possible. And if you would like to find out more about Patreon and the rewards and benefits, then there will be a link in the episode description. If you enjoy the OCD Stories podcast and would like to support us, please subscribe and rate the show wherever you listen to the podcast. And thank you to NoCD for supporting our work. If you want to find out more about NoCD, head to go.treatmyocd.com/the OCD Stories or click the link in the episode description. And quick disclaimer, guys, this podcast is not therapy. It is not a replacement for therapy. Please seek treatment from a trained professional. And until we speak, take care.